Hey, thank you for joining us for an episode of the Medicine Mentors, where we interview leading physicians on the best tips, lessons, and pathways to mastery for aspiring physicians. Our mission is to learn from top mentors the most effective paths to mastery and fulfillment in medicine and to spread their knowledge. Our guest for today is Dr. Bilusic, who truly is a remarkable role model, blending clinical expertise with heart-based wisdom. Dr. Bilusic is the program director of the NIH Hematology Oncology Fellowship, which provides fellows with a strong clinical grounding in hematology and oncology, as well as a comprehensive introduction to clinical, lab, and translational research. His current research interests focus on tumor immunology and development of treatment options for prostate cancer and other genitourinary tumors using novel targeted agents, therapeutic cancer vaccines, antibodies, and immune modulators. On this episode, Dr. Bilusic inspires us with his practical wisdom on providing cancer patients with the highest and most humane care possible, and on how residents, fellows, and other young physicians can find their inner resources, as well as utilize leadership, educational, and mentor-based opportunities to go from good to great. Thank you so much for being with us, sir.
Thank you for the invitation. So what inspires you to be an oncologist is really trying to make a difference and trying to make an impact. We all have lots of sad stories, but there are lots of good stories, in particular now with immunotherapy and even with standard therapy. There are always people who are exceptional responders who, were given 6 months to live and now they are 6-7 years in remission. And that really makes you feel very motivated. We all tend to remember those patients, like those patients who had bad outcome, you tend to kind of cope and not think about them, but you're really trying to make a difference and trying to give a hope. So your job as an oncologist, I found myself 50% of my time I'm feeling like a psychotherapist, trying to help patients cope and through all these stages of anger, denial, acceptance, and fighting against the cancer and trying to provide them the best guide. What do you do? And one of the most important things for people like you is that you have to treat them as your own family. Really, you see, they will ask you, okay, what if I was your father? What do you recommend? And it's a very common question patient will ask you. What if I was your mother? Would you still recommend me the same? What if you were in my shoes? If you as an oncologist trying to make a priority, trying to give them hope and trying to, help them accomplish a few things from their bucket list they want to accomplish before they die. And each patient has a different story. And I can just name one of the patients first come to my mind was one gentleman who really he always wanted to go to Doris County in Wisconsin, and he wasn't able to make it. It was really like his cancer was rapidly deteriorating, he was becoming very ill. And I really spent 2 weeks of trying to help him while in the hospital, fix his hypercalcemia, to put him in condition he can travel to Doris County. And he went to Doris County for 5 days, came back, was readmitted again, but he was very happy. He was very happy that he was able to accomplish his life dream to go to Doris County. And I think I've also felt very happy because I was able to help him to accomplish his life dream. Even though I didn't cure his cancer, he died of his cancer, but I felt, excited and motivated. Oh my God, I really make a difference for this gentleman, who was really wanting to do that. Another gentleman was very busy dentist, had very bad prostate cancer, and he was 62. And I realized that he's progressing through all the lines of treatment. He was working full-time, 12 hours a day. His wife died of pancreatic cancer a few months ago, before was that, and he was on his death row also, but he was just didn't realizing that he's going to have, that he's going to die also within 6 months or so. So I had serious discussion with him, and I told him unfortunately, you are not typical prostate cancer patient. Your cancer is more aggressive than average, and I'm afraid that you don't have much time left. You have no symptoms right now, but I think you should retire, spend time with your family. And he was shocked. Oh my God, you're telling me to retire? I feel fine, I have to work. But then we had very serious discussion. I understand you have to work, but unfortunately you're not going to have much time. And I think instead of spending 12 hours at a hospital working as a dentist office, maybe you should spend time with your family, with your daughters, and with your grandkids, because they're not going to have that opportunity next year. And then he thought about it for a day or two, and then he called me. He decided, I decided to want to listen to you. I'm going to quit my job. I'm going to retire. I have enough money, and I'm really going to move with my daughter and spend my time with her. And then he decided to undergo additional treatment, but then he moved with his daughter, and unfortunately he died 6 months later. And then his daughter came to me after he died, like a month later, to thank me that I really made a difference. And he was able to spend the last 6 months of his life with family and really focus on what is the most important thing. Not about your extra dollars you're going to make, an extra job. It's really spend time with family so they have memories, something to remember. And those kind of things are, I think it's important driving force for us oncologists. There are lots of sad stories, but even the saddest story, you can make an impact. You can change memory. You can really change people. You can help people accomplish their dreams. And really that's what drives you further. Because if you're just thinking, oh my God, cancer, people are going to die, there's no hope, it's very depressing. And it's, unless you try to make changes, and you can make changes in every single story, in every single patient, you have to identify what is important for them. If they don't see that, that they have to refocus on certain things, you have to help them. So it's a lot of psychotherapy. You're trying to help them, of course you're trying to treat their symptoms, you're trying to give them chemotherapy, but there's a huge impact of you as oncologists trying to them to understand, to prioritize things, to focus on more important things, to build memories, to fill their dreams, to help their family to cope.
Wow, Dr. Bilusic, you really opened my eyes to the value of this relationship with the patient. And it's not just the NCCN guideline and following the checklist or the algorithm. You really beautifully described how much of an impact, of a real impact, not just overall survival or progression-free survival, but the decisions that the doctor that really owns and really cares for every patient.
It is really important. And the other thing is going to be, that's one story, helping with the patient, but then also advocating for your patients. You will see that lots of your consultants, you're going to consult for, colonoscopy, for this or that. The other physicians, if they're not oncologists, then when they see stage 4 cancer, they just said there's nothing much we can do. Why do we worry? And you really have to fight. You really have to fight for your patient. So I had a patient with prostate cancer stage 4, but there was something growing in the stomach, and then GI didn't want to scope it. Has stage 4 cancer. There's no. So you have to educate. Well, he has 7 years to live. If this is something in the stomach, So each time it's have to go extra thing and beyond, And patient comes with stage 4 cancer and pneumonia, intubated in ICU. And then ICU attending wants to extubate the patient and make patient DNR. It's well, advanced directive says that if I have terminal condition, I don't want to be intubated. Yes, if you have terminal condition and you're going to have cancer in the next few days, of course, but if you have pneumonia or you choke on a peanut, that's a different story. If you have stage 4 cancer, you have many, many years. So it doesn't mean necessarily that this choking on a peanut is terminal condition. The cancer is terminal condition, but then also life is a terminal condition, because we're all going to die one day. So you have to just rephrase things and help your colleagues and consultants understand that you really have to fight for every single patient, and that's the other part of the fight you have to do. So one with the patient, the other one with your consultants, and then third is with insurance companies and people who are paying for care, because sometimes they say this drug is not approved. Why don't try this drug? And then you have to really write the letters, appeal, and help them, receive the best treatment they deserve.
How did you become this way, Dr. Bilusic? What's the secret? How did this extreme degree of ownership and caring and empathy and compassion you have?
I think
where does this come from?
This is something that you really have to work on, that you have to treat how you would treat your mom. And you do everything for your mom, really. And then if you treat everybody like your own family, then you see you go above and beyond. And even let's say when the other hospitals are calling me about my fellows, they wrote for a recommendation letter. Sometimes they call you, ask about the fellow, and frequently they only ask one question: would you let this fellow take care of your own family? And if you say yeah, because you have high level standards for your family, so I can write a very nice letter. But if somebody writes in the letter, when somebody's applying for a fellowship and the program director writes for a resident, don't mind if Dr. So-and-so take care of my own family, that means a lot. It means that we really have very high standard for that person, because for your own family, we tend to have the highest standard than for average patient. So if you try to change that and try to take care of everybody as your own family, then you become, it's draining. It takes extra time, extra energy, but it's very rewarding because at the end of the day, you feel proud that you accomplished something. You feel proud that you made a difference. And that's what this is about, trying to make a difference. And if you change one patient, one life story, one family that make a difference, you're really impacting, we cannot change the world, but if you change the world around your patient world and your environment, people at work, you can make a difference. And then each one of us is supposed to change the world around ourselves, what we can do.
Dr. Bilusic, I understand that you talked about advocating for patients, that you've been advocating for students and residents since medical school when you were involved with the Hippocrates organization, and then as a chief resident during your residency, now as a program director. Where does that passion for leadership, passion for advocating, and as you said, where does that come from?
So, the leadership is, some people are born with certain kind of skills, but in addition, just being born with, have, gifts to be a leader, it's also the training is important. It's really important to use every single opportunity for leadership training. And there are lots of leadership opportunity training. Each major university has leadership courses and training. NCI has a leadership courses you can take. ASCO offers, all professional organizations. So try to utilize as many leadership opportunities in training and volunteering for smaller things. Sometimes you do small things and then goes to bigger things, and then you realize in pretty soon, like a couple of years, you are just becoming of one small group team lead or something. You become much higher thing, you have more responsibility.
What's your advice to a resident or a fellow who wants to start their career in research there? I mean, we know it's a long and arduous journey. Yeah. What advice would you give them?
So the typical thing is for fellows, you really need to have a mentor, more than one mentor. You need to have a coach, and you need to have a sponsor. So what the difference is? The mentor, coach, and a sponsor. So mentor is one to tell you, give you advice, share experience. But mentor will not do extra mile. So for instance, if I'm your mentor, I'm going to tell you, you have to give more public talks at ASCO. And then of course I know that. So that's mentorship, yeah? The sponsor is, you have to give more talks at ASCO. Let me see how I can help you. I pick up the phone and call the people, do this extra miles. And I say I have this guy, he's excellent, he's a good speaker. So me as a sponsor, I put my reputation on the table. Because if you go and have a speech and you do a lousy job, the next time when I pick up the phone and call people, it's not going to happen. Because what he knows, the last time he recommended this guy, he was horrible, it's not going to happen. So you really have to try to identify mentors. The most important, identify the sponsor. Mentor could be a sponsor, but sometimes you need to have a sponsor who is not your mentor. So it gives you this opportunity. And coach is a person who will train you specific skill. So let's say if you need to learn how to do bone marrow biopsy, you need a coach. Your mentor will not teach you how to do bone marrow biopsy. Or, you have a coach, you learn how to play tennis or basketball or play piano. So those specific skills, how to give public talk, how to write a paper, how to write a grant, those things you need a coach for. So you need to identify people who can coach you. And coach could be your senior resident or fellow who has expertise, can teach you and coach you for specific tasks. Mentor, you have a lifetime mentor. So you have to be dedicated. You have to build your network. I think it's extremely important. Collaborators, people you work with, and just don't be afraid. Just jump into it. And at this point of your career, you're proven that you can accomplish everything you want. You're smart. You're hardworking. You finish medical school. You're finishing residency. So we all know that you can do things. It's just important things are who is your mentor and what your motivation is. If you're just doing something for I have to do something, if you're really not into it, if you're not passionate about it, people see that.
You've had so much success so early in your life, Dr. Bilusic. What do you think is the reason for that? If you had to look back and think back on...
So I think it's just, you have to be dedicated. It really requires extra work. Sometimes the opportunity, but I think the most critical thing is that you should be afraid. You should take challenges. Sometimes you do things without necessarily seeing, what I'm going to have out of it. Sometimes you do things just for goodness of your heart. And then later that pays back. So if somebody asks you, can you cover me for the ASCO? You don't ask back, when you're going to cover me back. You just cover. And that's typical thing. What I notice with my current fellows, they all immediately looking, what is going to be my immediate gain, or when you're going to pay me back. Sometimes you just do for the goodness of your heart, and things happen back to you, and it gives you a new opportunity. You will see, like, life is amazing, and whatever you do something, there's 5 other doors. You have to read. One of the important things is to you to spend at least 1 hour a day reading new things. That could be from your area of expertise, new things, and I think 1 hour of reading really puts you ahead. You try to be ahead of other, follow the science. There's so many new things happening daily that you have to be up to date with things, and it's hard, it's not easy. But you don't try to, I'm just going to study for board exam, or just going to study for dissertation. You have to study continuously, and this is a very important skill to develop.
If you had to tell one thing, I know we've talked about a number of different things, but just one thing from your personal and professional experience to young residents to remember for the rest of their life, what would that one thing be?
So one thing would be that you really should believe in yourself, and you should take care of your patients as your own family. I think, believe in yourself, being motivated, and even when bad things happen, when horrible things happen, you have to see that you are making a difference. And you're not going to see that unless you take care of your own patient as your own family. And then you can see those tiny things you make a huge impact on someone's life, on other people's life, and you really feel powerful and you continue doing what you're doing.
Thank you for hearing this episode of Medicine Mentors and receiving Dr. Bilusic's inspiring energy and knowledge. Dr. Bilusic has a way of embodying his wisdom, which makes meeting him a very uplifting and inspiring experience. We hope that you took Dr. Bilusic's messages about proper patient care to heart, and that you have some inspiration to take the next step in your practice toward greater wisdom. Please subscribe to stay updated on our newest episodes featuring the insights of top physicians. And please do comment about your experiences to keep the conversation going. Thank you for joining us for this opportunity to learn from the masters of medicine.